Hi friends, today I am going to talk about the action of aldosterone. Aldosterone is a mineralocorticoid secreted by the adrenal cortex mainly in response to angiotensin 2. In addition to angiotensin 2, it can be secreted by the stimulation of ACTH hormone, which is from the pituitary. Aldosterone is degraded or catabolized by the liver as the all other steroid hormones. Aldosterone acts on distal tubules and the collecting ducts in the nephron in the kidney and absorb the sodium inside the cells and eventually to the plasma. When it absorbs sodium inside, it drags more water and produce water retention too. How does this happen? Here you can see a cell here. This is a urine, a filtered urine. Aldosterone acts on distal tubules and collecting ducts and absorb the sodium through a pump here. So when it absorbs the sodium, cell must maintain its electrochemical balance. So it must pump out 1 plus ion inside the urine. So it's most of the time it pumps out the potassium. Sometimes it pumps out the hydrogen ions in places such as hypokalemia or acidosis. In those conditions, it used to pump out the hydrogen ion instead of potassium. Okay, now we look at the electrolyte disturbances due to the action of aldosterone in some disease conditions. You don't want to memorize the electrolyte disturbances. You can work out everything if you know the basis. So in Addison disease, there is low levels of both glucocorticoid and mineralocorticoid, that means aldosterone. So when there is a low levels of aldosterone, this pump activity become lower. So there is a tendency to sodium is lost by urine because this pump is not active. So sodium tend to excreted via urine. So this patient can have low sodium in the plasma. At the same time, potassium cannot be excreted. So potassium level is going to be higher. Okay, in Crohn's disease, they have higher aldosterone levels. So this pump going to be activated more, so stimulated. So there is more sodium and water absorption. So potassium excretion is become more. So this pattern will be reversed. So they can have higher sodium level with low potassium level in Crohn's disease. In cirrhotic patients, as you know, aldosterone catabolism happens in the liver. So when patient have cirrhosis, that means aldosterone cannot be degraded. So aldosterone inside the plasma will increase, as you can see in Crohn's disease. So these patients have more this pump activity. Because of that, they can have they absorb more sodium and water. So water retention happen eventually. This can severe the conditions ascites condition in those patients. The ascites become more severe in those patients because of the higher aldosterone activity. This is why we use spironolactone, especially to these ascites patient with cirrhosis. We use specifically this spironolactone as a diuretic, because spironolactone is a anti-aldosterone. It blocks the aldosterone receptors in the kidney. So this is a aldosterone antagonist. Okay, similarly in heart failure too, patients with heart failure cannot pump blood properly to the kidney, so renal blood flow is reduced. Due to low renal blood flow, patients tend to have activated renin-angiotensin system. This activated renin-angiotensin system will increase the production of aldosterone. So these patients have higher sodium absorption in the kidney, which in turn produce more water retention, and the patient's heart failure become worse. Okay, thank you guys. Thank you for watching. Leave your comments. Bye.